My name's Damian Ferrie and I'm the Chair of Mental Health Victoria. And really it's my great pleasure to be here exploring really important issues around mental health and ageing. One of the interesting things that has emerged over the last couple of years, particularly in the context of obviously the announcement of a Royal Commission into mental health and a Royal Commission into the aged care system happening at the federal level, and a productivity inquiry into mental health, is that it's provided an opportunity for many people who have been concerned about mental health in a variety of settings. And probably we're most used to some of the crisis end of the conversation about mental health. Critically, people are concerned, and rightly so, about those people who may at different points be a risk to themselves or to other people in the community. But by and large, the service system that clusters around mental health looks after the hundreds of thousands of people in Australia who are touched every day by the effects of mental health. Today brings together a really important section of that service system, those carers and consumers who are also impacted by mental health, particularly as people age. And it's interesting, this morning the day was opened by Gerard Mansell, the Commissioner for Senior Victorians. And interestingly, he made the point, more an observation, that thinking through the issues of dementia, delirium and mental health is actually quite poorly understood, poorly diagnosed, and without a good service system response, which often means that people who are aged don't have the necessary services and the response that they need to live a good life. And ultimately, those of us working in the mental health environment are people that are fundamentally committed to supporting people to live a good life. And that means participating within community, included, welcome, and able to live in the best possible way that they would like to. And that means both employment, it means both within a service system that's integrated, because what we know is, and this is what we really struggle with, is how do we deal with not only a diagnosis of mental illness, but often the stigma that results with that. And it's the stigma, less so often in the treatment, that causes the greatest harm within community.
I think it's been a big message here today has been the lack of focus on older Australians, whether they be over 65 and therefore falling outside of funding limits, but also in aged care. Are you confident that, for example, the Royal Commission here in Victoria into mental health is going to look at their needs, and equally that the Aged Care Royal Commission federally is going to look at mental health? Is there a worry that they won't cross over?
It's a really good question, and it's something that Mental Health Victoria was very pleased to host a gathering earlier in the year between at an event at which the Victorian Minister for Mental Health, Martin Foley, and the Productivity Commissioner leading the inquiry into mental health, Stephen King, both spoke. And I have to say, we were very relieved when we heard the Productivity Commissioner, Stephen, say that he also ran a concurrent inquiry into the financial system at the same time that the Royal Commission into banks was being run, and he left us with a great level of optimism that in fact the capacity for not only different jurisdictions but different parts of government to work together, that was actually not only an aspiration but something that had happened and will happen in this environment. It's a good question. It's one which we as a peak organisation are very keen to ensure does happen, and I think there's enough goodwill within the broader sector and within the various parts of government to ensure that the respective inquiries underway will be collaborative and, in a sense, dovetail into one another appropriately.
And out of today, what are you hoping to do? Given all those inquiries are going on, what are you adding to with today's event?
It's a really good question, and a comment was made earlier this morning that the new aged care standards, which came into effect on the 1st of July this year, furthered the consideration of how we ensure that the rights of aged Australians are well cared for in relation to mental health. My hope would be these sorts of conversations are relatively new. Aged care providers, mental health providers, carers and consumers coming together to talk. The very first instance that starts to happen, awareness is being raised. That's the beginning of creating good policy responses, both within government and within the service system. So my sense is, modestly but confidently, being able to say, look, these are important conversations. We need to take them seriously. We need to listen to them. We're confident that we've heard enough, that the Royal Commission has heard much of the issues of aged care and mental health. So I remain confident that this conversation is the start of ongoing conversations and service responses.
Any other takeaways from today? Anything that surprised you, worried you?
Yeah, look, it's interesting. We were delighted to have a range of carers and consumers speak, and their voice was well heard, and we had a fantastic speaker who spoke this morning about his own experience of 80 of actually being placed on an involuntary treatment order. And he spoke about that experience. He spoke about the real trauma of that experience, but also what he learned from it. And he was also very, generous in his response to those around him within the public mental health system who cared for him. That for me basically gave me great hope, and you know why I guess we at Mental Health Victoria are so confident that we should and are really pleased that various parts of the community and government are absolutely responding to this. The comment was made by a speaker this morning that the Victorian government's call for a Royal Commission into mental health, a statement by the Premier that the system is broken, and he would recommend that he would embrace all recommendations from the Royal Commission, really does give me great hope for the future.
That was around that was showing compassion. That was a conversation about compassion, that we can often see it in staff. It's the system that has been the barrier to that expression.
It was a really good conversation where some specialists on aged care and an aged care provider said, of course we're interested in client-focused service delivery. But she said, you know, I talk less and less about customer service delivery and client focus. I talk about building relationships, because when you've got relationships, that is the beginning of kindness, friendship and compassion. And I think that's absolutely right.
Thank you very much, Damian.